Assalamualaikum and hello. My name is Nur Amisha Ila binti Fakri. My student ID is 2023814904. Today we will talk about food allergies. What is food allergies? Food allergies is an abnormal immune response to food. Many people have food allergies since born until adult. Here are the examples of food that famous for allergic people. The first one is peanut. Second one is eggs. The third one is seafood, such as prawn, squids, and shell. Milk, soybean, and wheat. Here are some several potential impacts of food allergies. The first one is health impact. Several allergic reactions that called anaphylaxis. Peanut allergy can cause life-threatening reaction, including difficulty breathing, swelling, and a drop in the blood pressure. Immediate treatment with epinephrine is often required. Second, chronic anxiety about exposure. Constant vigilance about avoiding peanuts can lead to stress and heightening anxiety, especially for children and their caregiver. 3. Dietary restriction. People with peanut allergies often have to avoid a wide range of foods, including those that may be cross-contaminated during manufacturing. Moreover, the potential impact of food allergies is lifestyle impact. It can make our lives change 360 for everyone that have allergies once in their life. Social activities. Dining out, attending parties, or traveling can be challenged due to the risk of accidental exposure. Second, educational challenge. School and daycare center may need to implement strict policies to prevent peanut exposure, such as peanut-free zones or banning certain foods. The third, economic burden. Purchasing allergen-free foods or medicine like epinephrine injector, EpiPens, can be costly. The price of medicine is so expensive, so I think the government should lower the price for people who have allergies to buy their free food of allergies and their medicine. In addition, emotional and psychological impacts was the highest impact for allergic people. Stress and anxiety. The constant threat of accidental exposure can cause significant emotional distress for individuals and their families. It can make them feel alone. Social isolation. Children and adults with peanut allergies and the other food allergies might feel excluded from social events or activities where food is involved. They will don't eat and avoid to join any event because they feel unsafe. The third is impact on parents and caregivers. Parents may experience guilt or fears about their child's safety, leading to overprotectiveness or strain on family dynamics. Hence, parents should give a support to them to their feel calm. Last but not least is economic and societal impact for food allergies. Healthcare costs, recurring visit to allergies, purchasing emergency medication, and hospitalization from several reactions can add financial strains. Product labeling and food industry chains. Manufacturers must adhere to strict laws and may need to invest in allergen-free production lines to accommodate allergic consumers. It can make them happy.
Next, methodology. Such diagnosis of food allergy could have profound implications in health, emotion, social life, and even the way one eats. Because such diagnosis can be so potentially impactful, accuracy in the process is highly important. Many avoid certain food because they think they could be allergic without ever consulting to the doctor. In fact, this usually results in unnecessary stress and challenges that may have been avoided. There are few tests need to be done to identify the type of allergies. So we have skin prick test, skin scratch test, intradermic test, skin scrap test, and patch test. There are two quite popular tests to identify types of allergies, such as skin prick test and skin patch test. So, skin prick test can be done by applying small drops of allergen extract on the skin, gently pricking through each drop with a sterile needle, and observing the skin for any reaction after 15 to 20 minutes. So, patch test, we need to apply a small amount of potential allergens to the skin and monitor for any reaction. So currently available modalities routinely used to diagnose food allergy is skin prick test. Usually clinic would do a patch test, but these tests have many side effects. For example, slightly swollen, prick, itchy and pulp. So before doing this test, doctor will questioning symptoms and do a physical examination. The patient need to shower but don't apply any product on skin, such as skincare or lotion. So there are two controls. We have positive control and negative control. And positive control contains histamine that causes an itchy and raised spot shortly after the exposure, while negative control contains lean that won't cause any will to do. So this is the statistic for food allergies. So according to the statistic, cow milk allergies are the most common, affecting 28.6% of people. Tree nuts allergies come next at 23.8%, followed by soy allergies at 14.3%. So peanut and egg allergies each impact 9.5%, while wheat, fish and shellfish allergies are less common, each affecting 4.8% of people.
Today, I will present some effective dietary management strategies to avoid food allergies. To begin with, it is crucial to identify and avoid trigger food. The first step involves undergoing allergy testing such as skin prick or blood test to confirm food allergens. Following that, individual can adopt an elimination diet under the guidance of healthcare professionals. This approach systematically eliminates and reintroduces food to identify specific allergens. In addition, reading food label is essential. We must carefully check ingredient list, particularly hidden allergens in processed food. Moving on, achieving nutritional balance is equally important, especially when avoiding specific food. For instance, individuals with dairy allergies can substitute calcium-rich options like leafy green, fortified milk, or supplement. Similarly, for those allergic to eggs, alternative protein sources such as legumes, tofu, or fish can be incorporated into milk. Furthermore, those with gluten intolerance should ensure fiber intake through gluten-free grains, fruits, and vegetables. Next, let's discuss the importance of planning safe meals and preventing cross-contamination. Preparing homemade food is one of the most effective ways to control ingredients and avoid unintentional allergen exposure. Using substitute ingredients like oat or soy milk can also help maintain balanced nutrition. Moreover, meal prepping, where meals are prepared in advance, is an excellent way to minimize risk when dining outside. Finally, preventing cross-contamination is vital, especially in shared space like restaurants and schools. In restaurants, it is important to ask how food is prepared and cooked to ensure allergens are avoided. Likewise, using separate containers for allergen-free food help prevent contact with allergens. In school, educating staff and peers about allergen is key, while keeping necessary medication readily available in case of emergencies.
Possible complications associated with this condition. First, let's talk about anaphylaxis. This is the most severe and dangerous allergy reaction that can happen after exposure to a food allergen. It can occur within minutes and spread quickly throughout the body. Some key symptoms to watch for are the tightening of airways, swelling of the throat, difficulty breathing, and even issue with the cardiovascular system, like a sudden drop in blood pressure. Because anaphylaxis progresses so rapidly, it is considered a medical emergency and requires immediate treatment with epinephrine, often delivered through an auto-injector like an EpiPen. On the other side, we have atopic dermatitis, commonly known as eczema. Unlike anaphylaxis, eczema is a chronic condition, meaning it lasts long-term and can flare up rapidly.
It causes the skin to become red, itchy, and inflamed, which can be uncomfortable and hard to manage, especially for children. The triggers vary but can include genetics, a weakened immune system, and environmental factors like allergens or irritants. Continuous scratching can worsen the condition, leading to cracked skin, infection, and discomfort. While there's no cure for eczema, treatments like moisturizer, steroid creams, and avoiding triggers can help keep the symptoms under control and improve the quality of life. Now let's move on to food protein-induced enterocolitis syndrome, or FPIES. FPIES is a severe gastrointestinal reaction, and it's often seen in infants and young children. Unlike typical food allergies, FPIES symptoms don't show up immediately. They often appear hours after consuming the trigger food. Food like milk, soy, and grains are common triggers. The symptoms are pretty intense and include repeated vomiting, diarrhea, and dehydration, which can lead to a serious drop in energy and body weight. Because of the symptoms can mimic infection or stomach viruses, FPIES is sometimes hard to diagnose. By identifying the triggers and avoiding them is the best way to manage the condition. Immediate medical attention is crucial if symptoms appear severe. Next, we have eosinophilic esophagitis, or EOE. This is a chronic immune condition that affects the esophagus, the tube connecting the mouth to the stomach. It occurs when its type of a white blood cell called eosinophils builds up in the lining of the esophagus, causing inflammation. Over time, this can lead to symptoms like difficulty swallowing, chest pain, and food impulsion, which means food can get stuck in the esophagus. For children, EOE can also cause nausea, vomiting, and failure to grow properly due to poor nutrition. The condition is often triggered by specific food, so identifying and eliminating those triggers through allergy testing or food elimination diet can help. Medication like steroids are also used to reduce inflammation and relieve symptoms. In conclusion, food allergies can be a challenge to individuals due to the risk of severe complications such as anaphylaxis, gastrointestinal issue, and respiratory difficulties. Allergens like peanut, eggs, seafood, soybean, milk, and wheat are among the most common triggers, requiring individuals to practice strict avoidance and vigilance. Understanding the mechanism of food allergies, the immune response, and recognizing early symptoms are crucial for effective management. This case study highlights the importance of early diagnosis, how to have a management plans, and the role of public awareness in mitigating the impacts of food allergies. Ongoing research and education are essential to improve the quality of life for those infected and reduce the risk associated with this condition.